Good afternoon. Welcome to today's webinar presented by Robert Wood Johnson University Hospital Somerset in conjunction with Friends Health Connection. I am Serena Collado, Director of Community Health for Robert Wood Johnson University Hospital Somerset. Our topic today, the viral mask. Is it the flu or COVID-19? As COVID-19 cases increase across New Jersey, the resurgence coincides with the flu season to create what some people have called a twindemic. COVID-19 and the flu may have similar symptoms, which can be confusing. Here to help us get a better understanding of both of these illnesses, their similarities and differences, and how to protect ourselves is Dr. Ron Nahass, an infectious disease specialist who is the hospital's epidemiologist for Robert Wood Johnson University Hospital, Somerset. Dr. Nahass was recently honored by the Infectious Disease Society of America with the 2020 Wanakanamakorn Clinical Award in recognition for his outstanding achievement in the clinical practice of infectious disease. Congratulations on this honor, Dr. Nahass, and thank you so much for joining us today. So we're going to begin our webinar with about 20 minutes of a moderated discussion, and then we will open up the forum to questions and answers from our audience. Should you have a question for Dr. Nahass, please post that in the chat feature. So first, Dr. Nahass, I'd like to just start us off by having you tell the audience a little bit about yourself.
Sure. So as you alluded to, I'm an infectious disease physician. So I've done that now for over 30 years, hard to believe. And so my focus has really been on germs, if you will, and how they affect human beings. I am also, as you mentioned, the hospital epidemiologist for Robert Wood Johnson University Hospital Somerset. And in that role, I am responsible for providing oversight and guidance in the hospital's response to infectious diseases or contagious diseases. And obviously with the pandemic, we are heavily involved and focused on that. And the response to that infection is a large part of what I'm doing.
Thank you so much for sharing that. That's always very helpful to get an understanding of your role. So COVID-19 and the flu are both respiratory illnesses, but have some key differences. So let's look at what are the causes of COVID-19 and the flu and how they are different. So could you please share what those differences are and what the causes are?
Sure. So the flu we're all very familiar with. We get a flu shot every year. So a lot of us are already have some understanding of it. It's a viral disease, and it's caused by the flu virus. There's two different flu viruses that generally circulate, the flu A and the flu B. And so for those of you that may have gotten your flu vaccine, and if you haven't, please go out and get one. You know that your vaccine has 2 strains of influenza A and 2 strains of influenza B. The COVID disease is caused by a virus called SARS-CoV-2. That's the name for the virus. And that virus is part of a family of viruses, and you may have heard of them in the news. It's called a coronavirus. That term coronavirus is because under the microscope, that virus has a crown. Corona stands for crown. And it's a family of viruses that you actually know well. We all know it because prior to this year, we all have experienced or had some familiarity with coronaviruses because it is one of the more common causes of the common cold. So when you got a cold, a scratchy, itchy nose, that was caused by a coronavirus, but not the specific coronavirus that's causing COVID. That's a new virus that jumped from an animal and attacked and affected human beings. Both flu viruses and coronavirus actually come from animals before they affect humans. So those are the main differences of the types of viruses that cause these 2 illnesses.
Thank you for that. So then what are the similarities and differences in the signs and symptoms of COVID-19 and the flu?
Yeah, that's the biggest conundrum that we're all concerned about as we stare down the winter cold and flu season. And you alluded to this sort of term that's being used, the twindemic, if you will. We're all familiar with the fact that the influenza virus starts to affect human beings, you know, sometime around November. Thanksgiving and onward is when you might expect to see it. And most of us are familiar with that. You know, body aches, headache, cough, sneezing, fever. Those are the symptoms of the flu, but those can also occur with COVID. And so there is the conundrum or the difficulty for doctors and nurses trying to distinguish those two diseases. However, there are some rather unique symptoms that are associated with COVID. And you may have heard about them either from family members or in the news. Some of the more unique symptoms to COVID is this funny loss of taste and smell. That's actually not seen with influenza. So loss of taste and smell is unique to COVID. It is not seen in influenza. And the other thing that is a little bit more unique to COVID than it is with the flu is some of the gastrointestinal symptoms. So patients with COVID can initially have symptoms of diarrhea and nausea, really prominent as part of the onset of the disease. That's a little bit different than what we would see with influenza. So short of the usual things we think of with the flu, headache, cough, sore throat, fever, body aches, those are common to both. The other things I mentioned are the ones that are a bit unique.
Okay. So how long can symptoms appear after exposure and infection to the flu, and then similarly to COVID-19?
So we described the onset of symptoms as a term that we use. It's called the incubation period. The incubation period is the time from when you're exposed to the time when you get sick. So that's the onset of symptoms. And when you think of the flu, usually that's pretty quick. That's in the space of about a week. Maybe after a day, sometimes two, but usually by the third or fourth day, if you're going to get sick from the flu after being exposed to somebody, that's when it'll happen. COVID, as a disease, occurs a little bit longer incubation period. Although you can get symptoms from COVID within, say, 3 days, the average time period is between 5 and 6 days. So that's longer than we see with the flu. And unlike with the flu, where generally by the 7th day or 8th day is the outside window for developing the flu after exposure, for a COVID, you might actually see symptoms up to 14 days after exposure, so reflecting that longer incubation period.
Wow, thank you for that explanation. So how long can somebody spread the virus and, via flu versus COVID?
Right. So that's a really important point. And there are a couple of points that are similar and a few that maybe are a little bit different. The most important point to understand with transmissibility is that the transmission of both flu and COVID can occur in the day or two before you actually get symptoms. So contagiousness begins actually before we get symptomatic, and that's part of the problem. That period of contagiousness for the COVID disease or SARS-CoV-2 virus, it can be up to 48 hours before you get symptoms. Flu, it's usually a day, maybe two. So a little bit longer on the pre-symptomatic phase. And then on the symptomatic side, depending on how long you're sick, again, a little bit shorter for the flu, maybe up to a week. For COVID, it can be up to 10 days. So this has been actually well studied. The other thing that's a little bit more unique to the COVID disease, which makes it more challenging for us, particularly in the work that we do at the hospital in infection prevention, is that there is a fair number of people who get COVID who have no symptoms. And even though you have no symptoms, you can still transmit the disease. In fact, it's suggested that up to 30 to 40% of the cases of COVID occur as a result of transmissions from people who have no symptoms. That's a really big difference from influenza. That's rather unusual for influenza. That's the big challenge with COVID and why we're struggling to some degree with the widespread distribution of this disease.
So you're bringing up transmission. So let's talk about that. What are the differences between how COVID and the flu are transmitted?
Right, so we talked about the duration of transmission, the mechanism of, and there are some differences between COVID and flu. In regard to the actual transmission, how it moves from person to person, There aren't actually that many differences. And so what we learned with flu and the way that we can limit or prevent the transmission of that virus really apply in the setting of COVID. So we know that influenza virus is passed by droplet spread predominantly. Droplet spread means person to person by cough and sneezes. And so, you know, prior to COVID, we all learned about sneezing into our elbows and don't sneeze into your hand, and, you know, be careful about the distance that you might have around somebody. And when you're sick, to stay home and wash your hands a lot. The same things apply for COVID because it's passed in the same way. So the predominant mechanism by which COVID is transmitted is droplet spread, meaning in a 6-foot circle, person to person, someone sneezes or coughs, and that material from the sneeze or cough, if you will, lands on your eyes, your nose, or your mouth, and then you end up with the illness. That is the most common route. Now, there's a lot of discussion about the possibility of what's called airborne transmission. Airborne transmission, that the virus means that the virus hangs in the air and can travel further than that 6-foot distance. That represents a small portion, at best, of the transmission of both influenza and COVID. The majority is this droplet spread, 6-foot distance. A small portion is airborne, meaning longer distances. The virus can hang in the room. And even a smaller portion is from what's called fomites, meaning surfaces, objects get contaminated and then you can get sick from it. That really probably is not an important mechanism of transmission for either of those viruses. To obviate that risk, surfaces, door handles, packages, washing your hands really limits it, because the reason that it gets transmitted is it goes from a surface to your hand, you touch your eye, you touch your nose, you touch your mouth, and you get sick. That's an uncommon route, but washing your hands will protect you for that.
Well, thank you. So let's talk about risks. Who is at risk for severe illness from the flu and from COVID-19?
You know, similar risk groups, but there's some nuances to this that we pay attention to. So older individuals are at risk for both. We clearly know that. We also know that people who have underlying health conditions, heart disease, lung disease, cancers, those folks are also at increased risk for both. One of the things that seems to be particularly concerning in regard to COVID is being overweight. And it does appear that people who have what's called a BMI over 30, a certain level of weight, moderate obesity, would be at greater risk for COVID in a way that seems out of proportion to what we've experienced or seen with influenza. There also is a greater risk, and this is an interesting feature of both viruses, for influenza in the very young, more so than COVID. So it's still unknown. We're still learning about this, but the flu is a greater risk disease in the very young than is COVID. And so for reasons that need to be determined, that may actually help us in treatment and understanding what we can do to help us all. The young folks seem to not be at the same level of risk from COVID as they are from influenza.
Okay, well, thank you. Thank you for that explanation. So, you know, we hear so much in the news about all these complications. So what health complications can each of these viruses cause?
Well, both of the viruses, the predominant issues and the predominant concerns are the impact on the lungs. And so both viruses affect human beings predominantly in the lungs, and that effect on the lungs can cause trouble with breathing. And that really is the major concern. Now, over and above that, the impact on the lungs, multiple problems do occur with both viruses. Both viruses can be associated with secondary bacterial infections. That can be problematic for both. But the COVID disease has some rather unique complications that are different than what we see in influenza. And again, we're on a learning curve for this, and so we're still learning. But a couple of the unique features about COVID include the predisposition for developing blood clots. The medical term for that is thrombosis. And the exact reasons for that are unknown. So that's a unique complication to COVID that we don't see with influenza. Both viruses can affect the heart. The COVID disease, maybe the heart a little bit more than influenza. Both viruses can be characterized by a prolonged recovery period. And there's been a lot in the news recently about the so-called long hauler syndrome associated with COVID, where there's this very long recovery period after having had COVID, which can also be problematic. That is important to understand. The other thing that happens in a small number of individuals is both illnesses can be really characterized by a catastrophic organ failure syndrome. And that's what leads to a lot of the deaths in both diseases. Thankfully, those are relatively rare, but they can occur with both. The last thing I would comment on is a unique feature of COVID, which is an inflammatory disease state that has been reported mostly in children, but also in adults. And in fact, at Somerset, we reported one of the first cases of what's called the multi-inflammatory syndrome associated with COVID-19. And this is an immunologic disorder in which the body reacts to itself, somehow induced by the virus, that causes a unique set of features that has been described in kids and now in adults. And so that's unique to COVID as well.
Wow. Well, thank you. So, flu, COVID. Is it possible to get both the flu and COVID?
Yes, it is. And in fact, actually, we learned this in the beginning of the COVID pandemic here in New Jersey. It started back in March, so the beginning of March, which was at the tail end of the influenza season. And although influenza was waning at that point in time and COVID was starting to go up, we actually saw people who had both viruses. And so both viruses can occur at the same time. And it does appear that folks who do get both viruses are a little bit more at risk of having a more severe outcome from their COVID disease. So it is a concern, and that's actually one of the principal reasons why we continue to emphasize the importance of getting your flu shot, because Lord knows we don't want folks being at risk for both, and we don't yet have a vaccine for COVID-19. So yes, both diseases can occur together. We are concerned about that. We do have hope, however, that because everybody is working real hard at wearing a mask, watching your space, washing your hands, and staying home when you're sick, that we'll see less influenza, because remember what I said about the transmission. They pass in the same way. So if you're working hard at preventing the transmission of COVID, we will limit the transmission of the flu. And that was seen in the Southern Hemisphere. That has really come out of their influenza season. It was dramatically reduced in the Southern Hemisphere as compared to what would have been expected. And the thought is that that related to the activities to limit the spread of COVID.
So in community health, we spend a lot of time trying to promote prevention and keeping the community well, distributing masks, hand sanitizers, and soap. So in terms of prevention, we do have a vaccine for the flu, but not one yet for COVID-19. So who should get the flu shot? How effective is it? And can the flu shot help protect against COVID-19?
Right. So I think that the protections for the two viruses, influenza and COVID, have a lot of common themes. And we've emphasized that, and you can't emphasize it too much. But to start, clearly, vaccination for influenza is a mandatory activity this year. Anything we can do to limit the risk of getting influenza just makes all of our jobs, the clinicians' jobs, easier. The argument that's sometimes made is it doesn't work, the flu vaccine, or that it makes me sick. Well, the vaccine for influenza can't cause the flu. It's not a live vaccine. And so there's no way to get the influenza virus, if you will, or to get the flu from the vaccine. It just doesn't happen. And the vaccine, although not universally effective, is, depending on the season, 50% or 60% or even 70% effective. And even if it's 50 or 60 or 70% effective, that's way better than 0%. And in those people who it doesn't prevent the disease, it reduces the severity of the influenza disease. So there is great value for getting that vaccine, both from the perspective of protecting yourself as well as protecting others. In regard to protecting ourselves for both viruses outside of a vaccine, because we do not have a vaccine for COVID, it really does come back to the four principles that I mentioned earlier. Wearing a mask. The mask works for two reasons. One is it acts as what's called source control. So when you put a mask on over your face and your nose, you are limiting the ability of secretions to leave your nose or your mouth and enter into the air. And if you do that, you dramatically reduce the ability of the virus to be transmitted, either the flu or the SARS-CoV-2 virus. So that's really important. The second benefit of wearing a mask, it limits your ability, and Serena used her mask as an example, but I'll use mine, right? So I put it on, and it limits I can't touch my nose or my mouth. It really limits your ability to do that. And the hands can get contaminated. Now, we're all working hard at cleaning our hands, but if we put that mask on, we can't touch our nose and mouth. The third thing, which isn't as well appreciated, but is being recognized as an important consideration, is that the mask may reduce what's called the inoculum, the amount of virus that gets introduced into your nose and mouth. So if you're in a situation, someone has asymptomatic COVID, and you have a mask on, and they have a mask on, and the amount of virus that gets out or the amount of virus that gets into your mouth can be lowered because of that activity, that actually not only reduces the chance you get the disease, but appears to reduce the severity of the illness you may get. That's key in allowing us all to be successful fighters of this disease. So 3 key benefits of wearing that mask. That's why you want to do that. Number 2 on protection, watch your space. And when I say watch your space, it's that 6-foot distance and the numbers of people around you. Watching your space means that you always have a 6-foot diameter. Make believe you got this sort of cone of protection around you. And when you've got that cone of protection around you, you've got 6 foot every place you walk. And in order to achieve that, you got to be in a room with not too many people, and you got to be sure that you're spending 6 feet away from folks. If you get on an elevator and there are 4 people on it, you didn't watch your space. Take the stairs. Wait for the elevator to be less full. So wear your mask, watch your space, wash your hands. Washing your hands takes the germs off your hands, so if you do touch your nose, touch your mouth, or touch your eyes, you don't contaminate them. And the last one, be responsible. When you're sick, stay home. If you're home by yourself, drinking your tea and your soup, you won't be contaminating others. And those are the things that we can do collectively as a responsible member of our communities to help protect each other.
Great, thank you. I was going to ask you if there were different ways to protect yourself, but I think you really covered them all. So thank you for sharing that. Quick question: with the holidays approaching, as Thanksgiving and the December holidays, they're fastly approaching us, what advice would you give to families about celebrating safely during this time?
Yeah, this is a really tough issue for all of us, and I've had more Zoom calls, not only for webinars, but with my family, because everybody wants to ask me the same question. And so we just this past weekend had the same discussion and decided that just the nature of the circumstance was that we just couldn't come up with a way that we could safely be together. So we've decided to, limit our congregating, and we are only going to stay with our family units. We're not going to be having our extended family together. My extended family is big. I'm one of 6 children. I have 20 nieces and nephews, and my dad, who's 88, God bless him, we normally get together with him, and he actually said, you guys aren't coming over. So I think the real challenge is, acceptance of that. That's a real challenge because it is hard. If you're going to be together and you're going to link, I call it linking pods. So my family has 4 pods. I have 3 children plus my wife and myself. That's 4 pods. My brother has 3 pods. He's got 3 kids in 3 different colleges, and he and his wife. So that's 4 pods there. I'm 4 pods. That's 8 pods. So, you know, how do you do that in getting together with everybody? It is almost impossible, and you will contaminate each other if you do that. So if you're going to get together, you need to be in separate rooms if you're linking pods, and you've got to be honest about what the pods are. I just described to you a little bit about my own family. We all are different pods. And so linking pods together is a recipe for transmission, and it will happen. You will not avoid it. So if you're going to do that, you better make sure that you've got enough rooms in your house and enough bathrooms so that you're not crossing pods. Open the doors, ventilate the space. The other alternative, which I've talked a little bit about with other folks, is you can think about doing a tailgate Thanksgiving. I've talked about tailgate Thanksgivings. I'm not a big tailgate person for sporting events, but you know, if you do a tailgate event, you're outdoors, you each at your car. Your car is your safety pod. And so, you know, you think of it as that type of approach. That's the extent to which you have to keep your pods separate to limit your risk. There's virtually no other easy way to do it. So unfortunately, you know, that's not that simple. I wish I had a magic answer, but that's what I would tell you.
Well, thank you. So now I know we have a few minutes left with our webinar, but I want to definitely give our audience an opportunity to submit their questions in the chat feature. And why they're doing that, I know Dr. Nahass, you talked about hand washing a lot, and sometimes people aren't always have a sink accessible. So can you share with the audience what is the role of hand sanitizer and how effective is that versus actual soap and water? So I'm going to use you with all this COVID and flu talk. I'm going to
sanitize up, right?
Yeah, exactly.
Yeah, hand sanitizer works. There's just not a question about that. You know, the challenge with ready access to soap, I mean, soap and water works really well. Hand sanitizer works really well. But the access to soap and water is the challenge, right? It's not readily available. Hand sanitizer, you can keep it, you know, in your car. You can keep it in your purse. You can have access to it all over the place. And it kills the virus. It's also easier. When we look at healthcare workers, they actually do a better job, for example, when they use hand sanitizer and cleaning their hands than when they do soap and water. So it works, it's effective, it kills the virus, use it.
Great, thank you. So one of our very first questions, excellent question. What is your advice for individuals wearing gloves while out shopping and running errands? How can this potentially be a false sense of security?
Well, we just mentioned about hand sanitizer. It works and kills the virus. You can't sanitize your gloves. The gloves really are a false sense of security. You touch something with your glove, the glove is contaminated. You have no way to clean that. You touch something with your hand, you can clean it. So there really is no logic to using gloves. That actually is one of my pet peeves. I can't stand it. When I go to a store and see somebody with gloves, you know, who's actually a service person, I'll go find somebody else to work with. You shouldn't be using gloves. They're just not a safety net. It's just not.
Okay. So thank you for that. Our next question from our audience member, you know, is thanking you for all the wonderful information and your interpretation of what COVID does. The latest that this individual has heard was that wearing a mask can actually cause COVID. Is that true or false?
It cannot. And one of the things we discussed on this webinar was how the mask may actually reduce the severity of COVID should you potentially get it. So remember the 3 or 4 things I mentioned that the mask does for you as it relates to limiting the risk for COVID. It does not increase the risk for COVID. That's just not true.
Now, and maybe you can also share. So before I took out the surgical mask versus, excuse my reach, everyone, a cloth mask, right? So knowing that if you're going to use a cloth mask, it's important to wash it regularly. Does that have any impact on that?
Right. For healthcare workers taking care of patients, we're not using cloth masks. They don't meet the standard necessarily that we would feel comfortable with for the intensity of exposure. For the public out and about, cloth masks, it can be an important tool and are more comfortable in being out. And so as long as you're covering the nose and mouth, I think a cloth face covering is fine. Although the surgical masks, like you and I have shown, this mask is more effective than the cloth mask. The cloth masks are okay. The masks that are most concerning to me that are somewhat popular are these gaiters or bandanas. There's actually been some study that suggests that gaiters and bandanas increase the risk for COVID. So maybe that was actually to the questioner that asked earlier about a face covering. I hadn't thought about that till just now. But bandanas and gaiters have been shown to increase the potential risk of getting COVID, and as well as not protecting against transmission. So that may be the question that the questioner was actually alluding to. So certain masks are risky. So we should not be using gaiters and we should not be using bandanas.
Okay, great, thank you. So the next audience member has stated, I have heard that hospital censuses are increasing due to COVID again, but the cases don't seem as severe and need ventilators. Is that true in your experience? And is there a theory behind it? Like why?
Yes, that does appear to be true. The clinical experience is that the COVID disease in the second wave seems to be less severe. But there are a number of reasons why that may be the case. One is we are actually better at treating it. So the good news is that we've learned a lot in the last 6 months about how better to treat it. The second is that the demographic, the features of the people getting COVID this time around seems a little bit different. They're younger. And younger folks do a better job at fighting the virus. The third is that this time around, many more people are wearing the mask. Remember, I told you one of the benefits of the mask potentially is that the amount of virus that gets introduced to an individual is less. And there appears to be evidence that that reduces the severity of illness that patients can get. And the fourth reason may be that we do have therapeutics that do seem to work, particularly when given early. So remdesivir, which is an antiviral drug, and Decadron, which is an anti-inflammatory drug, are both now used regularly, and we use them far more effectively, I think, than we did earlier. So I think there's a number of reasons why the illness may be less severe. I don't think it's changed, but I think the features I mentioned are what's contributing to that.
So what are your thoughts about the list of states that need to be quarantined but not others? So what puts what puts that on the governor's list, one state on a list and not on another?
Yeah, I actually think that the list of states and the issue around travel restrictions is going away because it's widespread in the United States. So if you look at a map now, basically every state in the union except maybe one or two has a transmission rate and a test positivity rate that's above the guidelines as it relates to limiting travel. So I don't think travel restrictions at this point are logical. Any state, any travel poses risk. It's not the travel itself, it's what you do wherever you go that's the risk. So it's more about what you've done, not where you've been. And I think that the bottom line is that the disease is really widespread, more widespread than it was in the spring. We have way more cases already. I think the number is going to go up. I'm hoping that opportunities like this will help people understand how you can limit your risk. But I don't think the travel restrictions will be much longer in existence specific to states.
Okay, so I think you touched on this next question, but have not answered like directly, but why do the amount of flu cases in the US seem extremely low?
Well, we're not really in the heart of the flu season. The flu season is just beginning. I hope the questioner is correct, and I hope that the experience in the Southern Hemisphere with the lower cases there is experienced here as well. That is, I hope we have lower cases of flu. But the real peak of the flu season in the Northeast and in New Jersey is really, the end of December to January, February. So until we get through that time period, I don't know that we've had a lighter flu season. time will tell. I hope that's true.
Okay. And I know we're a little over on time, but these are great questions, and I want to make sure that we have an opportunity. So if you're good to stay with us, please stay on. We'll continue our questions so that everybody's questions are answered. So, we do a lot here at Robert Wood Johnson Somerset. So how well equipped is Robert Wood Johnson University Hospital Somerset in terms of handling an influx of the numbers in New Jersey as they continue to rise?
The hospital, we're well prepared at Somerset. When we gained a lot of experience in the spring, and our approach is to the deployment of COVID medical teams that are focused specifically on the treatment in a coordinated team-based fashion for the disease. And I think that served us very well, and we will continue that approach. Our performance as it relates to outcomes, despite the newness of the disease, was really quite outstanding in the spring. And so I think we're well positioned to be able to do that.
Okay, thank you. Is it possible to get COVID multiple times, like after a previous infection? Can you get it again?
Well, remember in the beginning, we talked about the fact that COVID, which is caused by a coronavirus, COVID is caused by a coronavirus, and coronaviruses are known to cause multiple infections. So you don't become really long-term immunity to coronavirus. It remains to be seen if that's true for the SARS-CoV-2 virus. There have been cases, uncommonly reported, of individuals getting a second episode of COVID. I'm not convinced, based on those reports yet, that this is a regular event, and I'm not, it's been long enough that I would have thought that if it was common, we would have seen it much more frequently. So far, at least, it hasn't been a frequent event. At best, it's a rare event so far.
Okay, great. This next question is going to go back to masks, little specific, but I think it's, very common question. So I made masks out of 2 layers of bandana and 1 layer of a t-shirt. Would that protect, or is the bandana a no-no regardless?
Well, the issue around bandana, it's not specifically the material that the bandana is made out of. It's how the bandana, I believe, is used. Most bandanas, and it's clear that how the bandana is worn and how the material is structured will have some impact on the function, and that's what's talked about in the literature as it relates to those types of masks. So if you take a bandana and the material itself is used as part of making a mask that is then looped over the ears and it's 3 layers, that would be different than, say, wearing a bandana that you've tied behind your head. So I would think that a mask that's made of that material in multiple layers would be adequate.
Right. So if like the bandana is just hanging there versus
like that, right?
Right, versus effectively covering and nothing being able to get up or around, correct?
Correct.
That is what you're saying is really what makes the difference in the use of the mask.
Correct.
Okay, just wanted to make sure, I was understanding. So our next question is, can we assume that the vaccine for COVID will be safe when it is released? I know there's a lot of anxiety, anticipation over the COVID vaccine.
I'm pretty certain the vaccine will be safe. I think the biggest question for me is not the safety. The safety is easier to answer because that's a more immediate impact that can be looked at, measured, and evaluated on a patient-by-patient basis or a volunteer-by-volunteer basis. The bigger challenge is how effective will a vaccine be? And we just don't know the answer to that. And until we know that, I think that's really the bigger question. Will it be effective? I recognize the concern about safety. Lots of people are asking that question. But I do think we will have awfully good information about the safety. I'm more concerned about whether we get data that shows that it works. It may be safe, but if it doesn't work, it doesn't matter. Yeah. So we need a vaccine that works.
So you had also mentioned and talked about how people were asymptomatic and could have COVID. So that brings up some questions about testing. So this next audience member is asking, should I get a test for COVID if I don't have any noticeable symptoms? Thoughts?
Well, I think testing for COVID, we continues to be our conundrum. We all would like, I certainly would like to have more testing capacity. We do not have enough. Believe it or not, still do not have enough testing capacity. That's still a problem. That being said, the reasons to be tested are if you have symptoms or you've had an exposure. To be tested just to be tested in the absence of an exposure or in the absence of symptoms is probably not wise, because we want to preserve the testing capacity for the circumstances I just mentioned. So testing if you're symptomatic and testing if you're exposed, but testing if you don't have either of those issues is not prudent.
Okay, thank you. The next question is around antibodies. So do you know how long antibodies last?
We do not. So that's the short answer to it. I wish we did. And that gets back to the question of, can you get recurrent infection? Will a vaccine work? The big question is, how long will the antibodies that are produced by the human being who gets infected, how long will they last? How protective are they? And we just don't have an answer for that.
Okay. So I'm going to kind of combine a couple of questions. So what are your thoughts on schools opening, and what about outdoor activities, be it with your family members or extracurricular activities? What are your thoughts about that?
Well, these are the challenges that we're going to continue to face until we do have either an effective vaccine or this virus runs its course through the population. Opening schools, that's a congregate setting. Congregate settings are the risk for transmission. I think that can be done safely, but there has to be consistency. And so that's been one of the challenges in the overall response is the challenge of consistency and the challenge of making sure that the tools that we have available with regard to, masking, barriers, distance, ventilation, all of those things are applied consistently. Screening to make sure that exposed individuals or sick individuals are not coming into an environment, a congregate setting, and potentially contaminating others around them. So anytime we're talking about that, and I don't care whether it's schools, houses of worship, anything that's an indoor activity where you're putting a bunch of people together, I think you can do it, but you have to be consistent in how you apply it relative to the things that we know that limit risk. And that's our big challenge. In regard to outdoor activities, it's almost unquestioned in my mind. Outdoors is great. The dilution effect of the air and the wind and the sunshine and space that's available just make a huge difference in the transmissibility of the virus. And so if there's any way, if you're going to do Thanksgiving and you can do a tailgate Thanksgiving or an outdoor Thanksgiving, that's the best. Outdoors rules as it relates to limiting the risk of transmission. So I just think that's an absolutely useful thing. What is not an outdoor event? One of my pet peeves.
Indoors? Would you eat indoors? Are you recommending?
No, I don't. I have not been to a restaurant. I still don't go to restaurants. I just don't think that's eating indoors is the greatest risk for transmissibility, period. It may be great that there's 20, and I feel badly for the restaurateurs, but 25% capacity, spending 45 minutes to an hour indoors with others around who are walking, it's a recipe for transmissibility. That's a problem. And a tent adjacent to a restaurant with sides is not outdoor activity. So people eat outdoors in a tent, but the tent has sides because it's cold with a heating element in it. You've now made an outdoor space an indoor space. So indoors is indoors.
Okay. So what are your thoughts on the percentage of ethyl alcohol? Some say 75, 65, or 70%. What is the best recommendation?
60% or higher.
Okay, Great. Now, this is the next set of questions is actually great questions. This viewer is saying today there are 3 different tests for COVID. So if you can explain each one of those tests, which test do you recommend is the most accurate? Saliva, nose, or the blood test? So why don't we start there?
So there's really 3 types of tests. One is what's called the nucleic acid test, nucleic acid amplification test, NAAT. That test measures the genetic material of the virus. And the popular term is PCR, but there are other techniques by which you can do an NAAT test. And those tests are the most sensitive tests that are available to evaluate the presence of the virus. NAAT tests can be done on spit, saliva, throat swabs, nose swabs, nasopharyngeal swabs. It's not the type of specimen, it's the type of analysis that's important. NAAT or PCR, whether it's done on saliva, spit, throat swab, nose swab, nasopharyngeal swab, doesn't matter what the specimen is. It matters the type of testing technology that's used. PCR or NAAT is what's important, not whether it's spit, saliva, or otherwise. The second type of test is an antigen test. Less sensitive, but reasonably sensitive mechanism to directly identify the virus. The NAAT tests, which measure the genetic material, directly identify the virus. The antigen test, which measures the presence of the virus as well. It's less sensitive, but still useful, particularly in symptomatic individuals. That can be done on a nasal swab or a throat swab as well, although most commonly a nasal swab. And then an antibody test. An antibody test does not tell you whether you have the virus. The antibody test tells you whether you have been exposed to the virus. It does not answer the question, is the virus present or not? And so that test is a blood test. It really has no particular role in evaluating somebody as it relates to exposure or symptoms, which is what we talked about earlier.
Great, thank you so much. Now, we heard a lot about long-term care facilities, and they were having surges in those facilities. So this audience member wants to know specifically, what are your thoughts about weekly testing that is required for the long-term facilities for their employees and everyone that is seeking to visit a family member?
Well, we know that the long-term care residents were of the highest risk group. The mortality rates in many of those settings was horrific, probably in the order of 25, 30, 35% of the folks who got it in long-term care facilities succumbed. And so just because of the severity, mechanisms to limit visitation basically shut the facilities down, as well as rigorous testing was initiated to try and limit further cases within those facilities. The mechanism of entry of the virus into those facilities was almost invariably either visitors or staff. And we continue to see staff with positive results. Visitation has been sorely limited, terribly limited. It's an issue in of itself. But the staff remain part of the larger community. And particularly as we're watching the cases jump in our communities, we are seeing numbers in the staff. And if we weren't testing the staff in those facilities, you would, and remember, you can be asymptomatic and transmit the virus. The contact staff has with many of these people who require a lot of attention is pretty close, and there would be a risk of transmissibility. So I think it makes sense that we're testing staff on a regular basis. I just think it's a good way to try and limit the further risk to these facilities.
Okay, this is just a follow-up question regarding the vaccine. When do you think it will be made available? Do you think it's being rushed through? And again, I think you addressed the part about taking it, but when do you think the first vaccine will be available for COVID?
Well, I don't think it's going to be available before the end of December, the beginning of January, maybe. So I say maybe because I don't know if the vaccine's effective. We're expecting to see the first evidence of the value of the vaccine. Did it work or not? The end of November, the beginning of December. So if the answer to that question, did it work, is no, then there won't be a vaccine to be distributed. If the answer to that question is yes, it did work, the next steps should happen quickly. Has to go before the FDA. The FDA will issue an what's called an EUA, emergency use authorization, and then it would have to be distributed. There's a lot of challenges with the distribution of the first types of vaccines that are being studied, and then administered. And it will have to be a sequential pattern of administration, most likely to first responders and high-risk individuals first. And it'll take a long time before that's distributed out across the country, assuming, again, it works. So I don't think we're going to see distribution of vaccine before I'll say the first of the year. And the wide distribution won't be till, later on in the year. And that assumes that the information we get at the end of November, beginning of December, is that the vaccine works.
Yeah, great.
Yes, I would take it if it works. If it doesn't work, no, I'm not going to take it.
So the next question is really for our expecting moms. There's a lot of concern that expecting moms have, like what is the risk, for the pregnant mom or the fetus, how high of a risk factor is pregnancy, and what can an expecting mom do to, again, safeguard herself?
Well, there appears to be a little bit of increased risk in pregnant moms of premature delivery, not a lot more. Women in general tend not to be as affected, and young women in particular don't tend to be as affected. So thankfully, it doesn't appear to be as great a risk as maybe we might have been concerned. There is some discussion about whether there might be a fetal syndrome, trouble in the unborn baby. But again, there's a lot of newness to some of this stuff, and all the answers aren't in. So that's the best I can do with that question.
Yeah, and I think we'll have we'll know more. I know we're doing a day in January. We'll be out in our next newsletter about how to keep mom and baby well, in January. So if our audience has more questions, please look for our next newsletter or check on our website for that up and coming webinar. And I think we have, we'll take the last two questions, or last question will be, are there guidelines that the elder care facilities must test staff every week?
Yeah, that we talked about that earlier. The staff have to be tested weekly. That's a Department of Health requirement.
Yeah, well, thank you very much, Dr. Nahass. This was a lot of great questions from our audience, and thank you, audience, for posting those questions. I think these are questions that everybody has had in mind, with everything going on in our world. So, having said all that, this is going to conclude our webinar for today. Please remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital, please visit our website at www.rwjbh.org/Somerset. Thank you again for joining us, everyone, and have a great day.